Okay, so perfect. It's 12 o'clock right now, and let's start our seminar. So this is our third College of Political Health Research Roundtable Seminar. And we're very excited to have you all here to listen to, a topic probably in the heart of many of you, climate change and health. We have three representatives from actually two different departments, and they will be telling you about their research in climate change and health. So first is Dr. Heidi Brown, who is a professor and program director in epidemiology. And then we also have Chris Lim, assistant professor of environmental health science, and Dr. Mona Arora, who is assistant research professor and also in the Department of Community Environment and Policy. And she also working with a number of research projects, and SCORCH is a center we have here. She is one of the multiple PIs and also community engagement co-director. So our college established this seminar series to increase communication and showcase of our faculty excellent research. And so I should introduce myself. I hope by now you all know me. My name is Zhao Chen. I'm a research associate dean for the college. And I will be really appreciate your feedback on this lecture series. We're going to continue next semester as well to hear what topics you would like to have people to present here. So in the past 2 months, we had occupational health, diverse community, health for diverse communities, and today's presentation. Next one would be the women's health. We are hoping this opportunity will increase faculty and student interactions and bring in research opportunities, internship opportunities to you all. So we would like to do a land acknowledgement. We respectively acknowledge the University of Arizona is on the land and territories of indigenous peoples. Today, Arizona is home to 20 federally recognized tribes, with Tucson being home to Ohlone and Yaqui, and the university strives to build sustainable relationship with sovereign native nations and indigenous communities through education offers, partnerships, and community service. So with that, I would like to welcome Dr. Heidi Brown.
Got myself a timer so I don't go over. I have 10 minutes to tell you all about me, which is going to feel slow for you, fast for me. I'm supposed to introduce myself as well as my research. So I'm going to start with myself in the way that I thought was kind of funny, which is I'm Gen X, and what I think is kind of fun for me is that my parents are a silent generation, and I'm raising alpha generation, which I think means I have something in common with each and every one of you, but I suspect that we're broken in our transitions in so much as if you're Gen X, you're probably not raising Gen Alphas. But correct me if I'm wrong, and come and talk to us, and maybe this is a place where we have something in common. And I hope these movies mean something to every one of you, and if not, you have homework. But what I did want to talk to you about today is specifically the work that I'm doing on climate and change and health. And this work is the work that we've been doing, and I'll call it through the BRACE lens. And I'd like to talk my way through it by first introducing you to what BRACE is, and then telling you really quickly, because my time will run out, on what all this project has done. And then I'm hoping that I'll wrap it up with why I think you should care. And so what is BRACE? So I've been working on the BRACE project here at the University of Arizona. It's a CDC funded project. It's really quite phenomenal to me and fascinating in that it's from the CDC, it goes down through ADHS, and then they're sort of contracted with the universities, U of A and ASU. And I've been on the lead of this project since about 2013. And it's kind of, the idea behind it is we're going to be facing these climate hazards. and how do we get ourselves ahead of them, and how do we get focused on what we're going to do about them. And so they have these steps. They started with, you know, like, what do we know about the vulnerabilities? Can we project forward as to what's going to happen? All right, great. What are we going to do about that? Now that we've figured out what we're going to do about that and we start implementing it, then there's the evaluation. And they're sort of in the last, we've sort of been iterating in these last couple of steps, but then also identifying new hazards as we go along. I don't get to take a lot of credit for this because this is really ADHS that gets the contract. But interestingly, Arizona has been part of that BRACE project ever since the very beginning, which I think it's only 1 or 2 states can actually take that bragging rights, that it's kind of flipped in and out as to the other states that have been involved in it. And what is my favoriteest part about this project is that the CDC very early on built into the project this notion of collaboration, right? And so I don't know if you guys are familiar, we have these things that are called RISAs, Regional Integrated Science Assessment. And this was a NOAA idea that said, you know, we have all of this data, but nobody uses it, right? NOAA being the satellites and all that stuff in space. Nope, not nobody uses it, but it could be used for so much more. How do we get people thinking about using it for so much more? And so written into the BRACE contract is that they're supposed to partner with their RISAs. And we're really lucky here at the University of Arizona because CLIMAS is our RISA that has been here at the University of Arizona since 1996. Right? So we've had this very long-standing relationship, and so we're able to leverage that relationship. But the idea is, how do we get the best science, weather science, into public health, that it starts being used and we start understanding what we can do about it. And so it is amongst 2 of my very favorite projects for that very reason, is it's embedded to use science for implication. And I can't just, well, I can say that another dozen times because I think that's fascinating. That was the slowest part of my talk. Now it's like, because we got to get, I'm halfway through my time. So I told you we've been around for a long time. So we have been around for a long time. And you can see all of the various students that have done internships on this projects that have worked on this. Highlighted in red bars are the folks that are still working on it. But you can see that we did something with EPH tracking. We did the vulnerability projections, and then we had these very specific, each county can sort of apply for. Pima County has ongoing where they've done some cooling center work. Pinal County did some vector-borne diseases, Maricopa some planning, and we've sort of been in and off of these projects as we've moved along. That's BRACE, at least our version of BRACE here at the University of Arizona. So watching my time, what have we done? This was really a rewarding project and a nice COVID story for us, which is one of the first things we did was we had Pima County kind of come to us, and through a student who was doing their internship project was like, well, where are the cooling centers in Tucson? And I love GIS, so we decided we should make that a map that would be freely available for people to just go and look it up, because up until then it had been paper flyers that get posted out and handed out, hopefully to the right hands. So the first thing that we did was get that online, which meant, you know, calling everybody, getting their hours. COVID is hitting at about this time, which means all of the hours changed, so we could live update those things to make sure that we had that information. I'm really proud of this project because our map was picked up and then used by others, and now it's back into the hands of the people that own it, which is it's now Pima County, and they own it and they run it, and we helped and we're out of it. And one of the other favorite things about this project was that all of a sudden, like a year later, I got a phone call from Maricopa asking if we had those PDFs that we had made the previous year. And I didn't even know how many people were using the information that we had. And it was this nice little random, like, wow, go team. And as you can see, it's, well, we've got people covering up the team, but I'm going to move this because this is where I always put my team. I want you guys to see them. And they're always going to be on that corner. So then we also, still in this idea of the cooling centers and trying to look at where the cooling centers are, we kind of said, well, you know, who has access to them? Because that's the very next question, is where do you put the cooling centers? How do you figure out where to put them? So Sam Chambers, who has been working on this project, he's an amazing remote sensor, has kind of looked at specifically how accessible are they from a standpoint, if I have to walk there, can I safely walk there? And what we found is, you can see the blue with the circles around it is the safe walking zones. And what you can see is that when we think about social vulnerability across Tucson, which is the pink, There's not a lot of blue in the pink, right? And so there's a mismatch between the vulnerable parts of Tucson and their access to safely accessing cooling centers. When you add the bus routes, it gets a lot better and we get a lot more people finding these routes. I told you that BRACE is not just about, answering questions, but also evaluating and getting all the way through it. So this is a team. I like the what you don't see is all of the people that were on a team. We brought it into, I love doing this, where we brought it into the classroom. When we had folks that went out there and interviewed at the cooling centers, collected data to try to figure out what are the needs and what are we looking at. We talked to administrators and staff. Thank you. The people who helped out with the project here in the room. And we were asking specifically about challenges and needs. There was also a user survey of folks that are coming there. What are their needs and what are their challenges? And there's a couple of things that I find really quite fascinating about it, which is there's utility assistance. We found some holes that we can plug, right? There's utility assistance that's available, but people don't know about it. They don't know how to apply, right? There is ways, I told you that it's hard to get to the cooling centers in a safe walking, but there are services that are available that nobody's using. So it's really nice to be able to kind of see these things that we can do something about them. We also are really interested in looking at rural health. This was a project that was using nationwide data, the National Emergency Medical System data, which is just looking at EMS calls. And what we found is that looking at EMS calls, if you're in a rural area, you are going to do better at the end of your EMS call for HRI, for heat-related illness, in an urban area than you are in a rural area, right? Which is giving us another one of those, why is that we're having those challenges and what does that mean for a rural community? I love mosquitoes, so I'll just have to make sure that I bring this in there, which is not just looking at, as we start building resilient communities, what are the potential maladaptations? So I put in green infrastructure because I want trees and I want to collect the water and not have the runoff. Am I at risk of building breeding spaces for mosquitoes and bringing West Nile virus or other vector-borne pathogens into my area? And we found one in a survey that we did with a bunch of students that you see up at the top, and we're still working on this. We found one that actually did start producing mosquitoes. One of the next areas that I think we all should be talking about is multiple hazards, which is we talk about, I just did heat and I talked about mosquitoes and I can talk about wildfire, but when do I talk about them together? And what we're finding here is some data that we're actively working on is looking at FEMA data. And what you see in the transition between here and here is thinking about looking at dual events and how we're starting to see more where a county no longer just responds for heat in a given month, but they're also responding to heat and wildfire, or heat and flooding, or flooding and wildfire, which just makes it really quite challenging. And then we get into the public health messaging. This is, again, thinking about that public health messaging. If you're in a sort of wildfire prone area and you don't have air conditioning and it's hot and there's a wildfire going on, for the heat, I tell you to open your windows so that you get the air pulling through. For the wildfire, I tell you to close your windows so you don't get the smoke. What do you do, right? And how do we figure out how to make those messages more clear? So I am doing great on time. My last slide is, why do I think you should care? I think you should care because this is research with impact, right? We get to do both the science side of it and also the implementation science of it. And on that, this is work that we've done. The BRACE project has gone into ADHS and Pima County and Maricopa County planning as they go in to try to figure out how they're going to be prepared. As I mentioned, we made some simple PDFs that we just thought were going to be useful, and it turns out that they were useful, that we had people calling and saying, hey, are you going to make those again? How do we get a hold of those again for this year? I get to bring this stuff into the classroom and into the learning space, which is, how do we talk about this? When we talk about clinicians, do they have a role in and a responsibility to talking about climate change with their? Do you as students, as you go out there, if you're talking about wildfire, do you also talk about climate change? And how do we change that narrative? This is, I don't publicly speak very well, but this has led to changes in policy, changes in how things are done, and really getting our information out there. And then I'm really excited as I was pulling this, this presentation together. This is not related to the climate change and health work, but this is related to some of the other work. Is we write a scientific paper and sometimes it feels very, very academic. but sometimes you find that your academic papers are being cited in policy. And we had the joy of that experience coming up just recently, which is really a nice and rewarding part of it. And with that, my time is 1 minute over, so I'll sit down.
Hi, everyone. So today I'll be speaking about some of my research projects ongoing in my lab. So I lead a health and urban modeling lab here at U of A, Hum Lab. So in our lab, we study what's the relationship between human health and the environment, and we're especially interested in who are the susceptible and vulnerable populations, and how will future trends like climate change and urbanization impact this relationship. So in our work, we use epidemiology, big data, and statistics tools to try to answer these questions. But today I'll be talking about two of my main projects. One is using low-cost sensors for exposure assessment. So the thing about low-cost sensor is that they're increasingly popular, being used by citizen scientists as well as government agencies. So these sensors are about $300 to $400 per unit usually, and they offer the ability to generate a huge volume of data at a fraction of a cost. And they're being adopted by government agencies such as the EPA to measure wildfire smoke, for example, but also just particulate matter pollution. And local agencies, so for example, state of California has recently passed new legislation requiring their air monitoring districts to require community-driven sensor networks to measure air quality, in addition to regulatory monitors. So this is probably one of the most popular sensor called Purple Air. They're about $300 per unit, and they can be measured or mounted on walls at homes. So here's an example showing the city of San Francisco. So the map on the left shows a location of an EPA federal monitor. So in the city of 1 million plus, there's just one EPA monitor measuring air pollution levels. And this is really not capturing the fine and the spatial and temporal variability in air pollution. So air pollution levels can vary minute by minute, but also block by block. So Purple Airs, again, citizen science driven, and you can share this openly with the public. The map on the right shows the low-cost sensor locations across San Francisco, and this is able to capture the fine variability I mentioned across the entire city, and also share this data with your neighbors. Here's an example in Tucson. So on the map on the left is about 2-3 years ago, and on the right is about a month ago. So working with various community groups here in Tucson, we were also able to install a couple Purple Air sensors on school buildings, government buildings, and also homes. So we have a lot bigger coverage now here as well. So my PhD student Madi and Hassan, they worked with the city of South Tucson to measure or mount a Purple Air sensor at the city hall. And you're able to capture and measure this real-time air pollution levels at this specific location in Pima County. We also have a project working with, through funding from the EPA and working with Pima Department of Environmental Quality to install more expensive sensors called QuantiQ Module Air. So although Purple Airs are really easy to use and expensive, they can't measure the gas pollutants like ozone or the larger particles, PM10 accurately. So these are combined with cloud service to also provide real-time data to the public. So we installed about 20 units across Pima County schools across various school districts. And again, they're measuring PM 2.5, PM 10, but also NO2 and CO, which are really from traffic sources, and also ozone. So before they were installed, we placed them right next to an EPA monitor for about a month to co-locate them and measure their performance against a more expensive EPA monitor, but also against each other as well, because they can vary unit by unit. So for ozone, we found that comparing EPA monitor to these QuantiQs, they perform pretty well against each other. But we also found that like things like NO2, they're not very accurate. So we're working with the vendor to kind of try to fix this issue. But for PM 2.5 and ozone, we had high performance. Using the real-time data, and then we created an online dashboard called Sunset. So here are the sensor units installed across Pima County. So we have one school in Ajo, which is a dot you see way out in the left, but most are around downtown Tucson. So this again, people can access to visualize real-time air pollution levels, but also temperature and humidity as well. So here's an example during a dust storm episode capturing PM10 peaks. So this was about few months ago, I believe. So we're seeing PM10 levels as high as 900 micrograms per meter cubed, and we're seeing some variability across locations as well. People are also able to compare temporal trends and spatial trends and compare the patterns against each location. So for NO2, we're seeing hard to see the x-axis, but we're seeing high peaks during the rush hours, which is when, again, traffic-driven pollution, and also differences across locations as well. And we also have capability to visualize minute level information as well. So comparing locations, we're able to capture these real-time peaks in air pollution episodes so that people are able to capture both long-term trends, but also short-term trends as well. And finally, we're also measuring wind speed, temperature, and relative humidity. So we plan to use this data to also measure and model urban heat island effects across Pima County and Tucson. And another sensor network we established, this is working with a community group in Patagonia called Calabasas Alliance. They are very concerned about the mine that's being developed in Patagonia. So working with this group, we provided 10 sensors donated by ASU in this case, and we similarly developed this real-time dashboard so that community members are able to see, again, what they're being exposed to real time. Similarly, we're able to capture these real peaks in air pollution episodes. So you see for PM10, for one sensor, which is right by a major route for mining trucks, we're able to capture these real dust episodes and traffic episodes that are kicking up the dust and being captured by the air sensor that we installed as well. Future plans through various funding agencies and projects is to expand this network throughout Arizona. So through NI SCORCH, we're talking with the libraries at NUMA to also install additional sensors. We also plan to get some sensors installed in Navajo Nation as part of the Superfund project that just started. And then with SWESEC and ASU, there's a copper mine being developed in Sahuarita, so we plan to install some sensors there as well. So after all this installed, we'll be able to have a pan-Arizona sensor network that will be able to capture and compare patterns across different locations. And then the second project I want to discuss is an ongoing NIH project looking at environmental exposures and EMX activations. So we know that climate change will stress EMS systems as it's a very frontline public health infrastructure. But we don't know what's the national burden of heat and air pollution and EMS across different locations, and what are some of the temporal trends, but also disparities across locations and subpopulations. And another evidence gap that we plan to address through this project is to consider incident locations and time, as well as population mobility patterns. Usually in studies looking at air pollution or heat with health effects, we assume that people just stay at one location at the same time throughout the whole day, when we know that's not really the case. People move throughout the day a lot, actually. So how does considering this mobility pattern impact the relationship between these environmental exposures and health outcomes? So we're analyzing this data set called NEMSIS. So this is a national system tracking all EMS agencies, or about 95% of EMS agencies across the US. So as of 2023, there's 50 states being tracked, about 50 million activations, and also about 24 million transports and per year. The cool thing about this data set is that you can know when and where these activations occur. So we're able to answer questions like asthma-related EMS transports from schools, which is a very specific location that we can pinpoint and analyze the data. So this data shows asthma EMS transports by hour of the day, but also by month, and we're also able to compare patterns across years as well. The thing about Nemesis is that they also have a very public front-facing dashboard. So the one on the left is a heat-related EMS activation dashboard. On the right is the drug overdose dashboard. I actually put RIP there because it got killed during the Trump when Trump first came into office, but it's back online. So you can take a look and see locations and time periods that heat-related EMS activations pick up and fall down. So in my own research right now, I'm looking at what are the patterns and trends in heat-related EMS activations calls across the US. So we are able to examine this relationship across subpopulations, so sex, age groups, race, median household income, and also location as well. So we're seeing that heat-related EMS activations are occurring more frequently in male populations, but also in older populations as well. Across race, we're seeing highest incidence rates in Native Americans and Black populations, and also in low-income populations as well. And this is all increasing over time, but we're also finding that the non-heat-related EMS activations are also increasing at the same time. So once we break this down into comparing heat versus non-heat related EMS trends across geography, for example, on the left is the disparity in heat-related on the right is the growth between 2019 and 23, comparing heat and non-heat EMS trends. So we're seeing that heat trends are increasing faster than non-heat EMS activations in mountain region, Southeast, and also, I don't know what you call that region, but the Midwest. And that overall, there's also overall increase in heat EMS activations as well, as seen on the plot on the left. Another thing we observed is that when and where these heat activations are occurring has also changed. So plot A shows the distribution of heat trends across income groups. So in 2019 versus 2023, we're seeing that there's more heat EMS activations occurring in the low income groups. Plot B shows the month of the year. So it's actually the trend is shifting to the right. So there's more heat calls happening in August and September compared to 2019. Plot C shows a location of these heat calls. So more heat calls are occurring indoors versus outdoors compared to 2019. And then finally on plot D, it shows a time these heat calls are being made. So it's actually occurring later in the day compared to 2019. So we're seeing that although heat-related calls are increasing almost at the same rate as non-heat 911 calls, there's different patterns across demographics, but also location and time as well. So ongoing work using this data includes how does the impact of extreme weather events like hurricanes influence the EMS activation patterns? So we're linking the Nemesis data with hurricanes to see how, when and where peaks in 911 calls occur before and after hurricanes. Another project we're looking at is looking at air pollution and temperature impacts on cause-specific EMS activations. So not just heat-related EMS calls, but things like cardiovascular, respiratory, and also injury-related EMS calls. And finally, how does weather impact both response times and EMS activations? We're finding that during hotter days and wetter days, the time between the call and the time it takes to reach the person that called 911 is also increasing at the same time, but also the burden of EMS calls are increasing. So there's this double burden on EMS activations. So thank you.
All right, more on climate change. So, a little bit about myself. So I got into climate and health through a very scenic route. I took a very scenic route to graduating and getting my terminal degree, but most of my career has been working with public health and hospitals in emergency response. So I did a lot of work for about 15 years with local, state, and tribal health departments, and that has drastically informed my approach to the work that I do. So for today's kind of 10 minutes or so that I have, I'm going to focus on my work with SCORCH. If you haven't heard of SCORCH, SCORCH is the Southwest Center on Resilience for Climate Change and Health. It's a mouthful, but the acronym is great. So the mission of the SCORCH Center, which is NIH funded, is we're really looking at improving the health equity across arid lands. So globally, if we look at arid lands, that the percentage of area that is arid is increasing. So there's more and more people that are in these crosshairs of heat and other, tangential climate-driven events. And so how do we work collaboratively to improve health, well-being, health equity across the lifespan, right? And so that's anywhere from all age groups, all demographics. So SCORCH is a large center. We have various different projects. We have projects, that Chris is a part of and others are a part of, looking at heat exposure and its impacts on maternal and child health outcomes. We also have a project that's focusing on looking at urban green design and the trade-offs that could be that are being made, and how do we create more tools that are useful and usable. Within SCORCH, my role is I am a co-PI, but also I lead the Community Engagement Core with Dr. Paloma Beamer. And why that's important is, and what's really critical to the work that I do is what the diagram on the right side, which is our Community Advisory Board. So our approach is that any type of research we're doing, like my colleagues have said, we're really passionate about making sure it's useful. Like, is it really meeting the need and helping our decision makers make the decisions that they need to make, especially in an environment where, funding is limited, capacity is limited, but the demand is very high. So how do we make those ends meet? So our approach was right at the conception of SCORCH was to convene a community advisory board. We have 12 members on this advisory board representing tribal, local, public health, non-public health, community representatives. And the idea of this community advisory board, or CAB, is to really use them as a sounding board to help to listen to what they're working on, what they're perceiving as gaps and needs, and then trying to influence the research or conduct our research in a way that we're actually addressing some of those concerns. And if we can't do it, right, we can't be the be-all, end-all for everyone, we try to go to our partner network, and we have other layers of our advisory board that can help do that. On the left part of the screen is some of the work, and I would like you to think of this as like the translation work. So the research that's being done, how do we make sure it's translated to action? Translation, action, very big words, and it means different things to different community partners. In the Friends Innovation Days meeting that we were at earlier today, one of the concepts that came into being was that kept on coming up was know your decision makers. My decision maker, my mission is different in academia than someone who's in the health department. And that's something that I think many of us saw when we were responding to the COVID pandemic. Our mission area, our values are different, and we all bring those to the table, and that influences the type of decisions we need to make. I'm going to try to breeze through this, but these are my personal grounding values in the work that I do, that I've tried to kind of infiltrate into the SCORCH work. That really prioritizing authentic collaboration with communities, so really acknowledging the lived experiences of the people we work with, people we're representing, to try to make a more informed approach to the research that we do. And recognizing that the risks and impacts, everything we all talked about so far today, each one of us in this room is going to experience those differently. And that experience is going to change as we age, as we move. There's so many factors about it, and we can't take that away from that experience. And then just meeting communities where they're at. Everybody perceives the world differently. I've talked about the decision, the governance, right? All of those factor in. And so bottom line being, how do we break down these silos and work better together? This is the community engagement team. It is a very large team. I love the people I work with. And although I'm the one here, there's a lot of people behind me. So, or in front of me, some of you are here. Thank you to all of you that are doing this. Okay, about 5 minutes. I'm going to try to highlight 5 different distinct aspects of our community engagement work that we're doing. I love all of them. And at the bottom, you will see some student names. Those are students within our college that are working on those projects. So kudos to them for the leadership that they've been showing. So the first project is really trying to understand how is it that public health departments are responding to the heat crisis. We have sustainability plans, we have heat action plans, we have heat mitigation plans and adaptation plans, right? And they're housed in different levels of government. But at the point of the spear from a health standpoint is who's really calling the shots when it comes to the healthcare response when it comes to heat. It's naturally the local health departments, the state health departments, and their partners. So in this work that one of our students, Imran, is leading, is we're really looking at the heat action plans that have been developed by public health departments across the state, and trying to understand their effectiveness and how they're dealing with the health inequities coming exacerbated by heat. And so the 2 models we're looking at is the hierarchy of controls, which many of you, especially in EHS, should be familiar with, right? They're the gold standard for occupational health exposures and risk. So looking at it from that angle, and also the social ecological model to try to understand what levels of government, what levels of action, what domains are being more prioritized than others, and how can we improve the reach and the impact of these plans. Imran just presented at APHA, but we have a manuscript that we're hoping to submit in the next month. So really excited to get this one out the door. So the second one, and this one's really exciting because when SCORCH was funded, we convened our community advisory board, and we said, we said in the grant that we were going to do a needs assessment. Do we need to do that? And the bottom line was, no, too many needs assessments have been done. Don't waste your time. But guess what? All heat response is focused on urban areas. Think about it, right? It's natural. Urban, more population, more urban heat island effect, so more resources are directed there. But what's happening in our rural communities? Arizona, outside of the Tucson, Phoenix kind of corridor, we're all rural. So this is a neat project. We're actually working with many partners across the state. We're using a network of networks kind of model, and we're doing rural heat listening sessions in communities all across the state. And the purpose is to really understand the lived experiences, the barriers. What are they doing? What are they doing in a rural community to help protect their communities? What's working and what's not working. And the idea is, and the output is going to be, this is the exciting part for me, is we have an opportunity to take our findings. We're still going through our rural listening sessions through spring. We've done 5 so far. But the idea is we will be helping ADHS, the state health department, inform their rural heat strategy for next year and beyond. That just tickles me pink, I will say, just to be able to have that opportunity to just take that information, represent the voice of the communities and take it forward. What better way to kind of have an impact? So that's that project. And I do want to say just a note on that project, which is really neat, is in the listening sessions we've had had participants from EMS, law enforcement, Border Patrol, as well as libraries and schools present in those discussions talking about heat, all with one purpose. The third one I want to highlight just in the next couple minutes, Cooling Center Toolkit. Shout out to Roynie. I know she's here somewhere. She's right there. This is again another project that came to us at the request of our county health department partners. So Heidi talked about the maps, and informing cooling centers, but one of the other gaps that came out was, cooling centers, at least here within our state, we don't have any protocols. We don't have any standard operating procedures. And what's really important to know is most of the venues that serve as cooling centers during heat season are doing so voluntarily. They're not getting extra funding to be able to stand up operations for that. So most of them are going to be like your libraries, your community centers. They're just making their spaces available. So they're multi-use facilities. That's a challenge in terms of developing some standard operating procedures, because guess what? You can't tell them you must do X, Y, Z, right? So language matters. So a lot of the work we're doing in this space is we're talking to cooling center operators, their leads, to understand what's influencing how they respond, how long they respond, what are some of the best practices, to be able to inform this toolkit that Pima County Health Department will be using in the upcoming heat season, to train up new partners in the community, because the cooling centers that we have, we need to be able to expand them to meet the needs of our community members. Okay. So fourth one, youth heat and health education. I'll breeze this through this there. This is kind of like my kind of little baby project that I love to work on. This is coming from COVID. To be really honest, the conception of this work stems from the fact that, we're in public health and we just need to kind of take the bull by its horns. We lost trust. Public health lost trust. How do we rebuild that trust within the community? Trust in public health, trust in science. And my vision is that to build that trust in science, we need to start early. We need to start engaging students. We need to start engaging youth at an early age. And so this project really kind of culminates into that for me. We're partnering with various partners across the state. But the vision is to create some kind of engagement mechanism, some curriculum that can be integrated by STEM educators into their high school, middle school level classes that engage students in looking at the National Weather Service data, at the ADHS heat dashboard, to understand heat as a risk in their communities, and then to inform solutions within their neighborhoods and their municipalities. And then finally, heat and medications, like everything else that I've talked about, this one also came to us at the request of our state and our county health departments. And the bottom line was, the data shows that there's an increased number of people who are impacted by heat are using substance use, right? But tangential to that, we're starting to see that a lot of people who are succumbing to heat have multiple chronic diseases. So how are medications mediating the impact of heat? So through this project, it was actually it's a dual kind of purpose. One purpose is to try to better understand what the impact medications are having. So right now we're working with colleagues in pharmacy to pull together statewide, and if things work out, nationwide data on prescription medications, what medications are being prescribed more for what diseases, what age groups, and to try to understand those prescription trends, and then use that to inform some education both with healthcare providers, so prescribers, and the dispensers. The grand vision for this project is to be able to develop some kind of alert system within the medical kind of EMR databases. So that way, when someone's being prescribed a medication, they're high risk for heat, there's a flag that goes on that says, hey, you got to watch out. They're giving this person a diuretic. You're living in a location that has, 6 months out of the year, high heat. Consider changing the dosage of the medication, or consider giving them extra kind of guidance on how to take care of themselves while on the medication during heat. So that's it.
Get it? Okay, so we're gonna start a discussion. I think that there's a lot of very, very intriguing information being presented. We're starting with people now. You ready? For a lot.
Yeah, I have a question for Heidi Brown. Yeah, I was just wondering what sort of like vulnerable populations you're working with, especially in relation to the cooling center. And then can you name an example like where you said you're having impact on research of how that's impacting all of these vulnerable populations?
Yeah, so let me answer the second question first, which is the one that I mentioned is that we were doing work on, it's not directly climate change and health related. But we were working on gastric cancer and Helicobacter pylori. And we've been doing work up on the Navajo Nation, looking at what the prevalence is, what antibiotic resistance rates are. And it turned out we were pretty excited to see that as the Indian Health Services was revamping their policy about how to treat and how to screen for H. pylori, 2 of our papers were cited in that policy of the like why in this notion it is a bacterial infection that is treatable with antibiotics. But the screen to treat is kind of a policy that's not always sure and might not be the best policy in really low prevalence areas. But it got translated into policy up there because it is a very high prevalence area. And then for the cooling centers, and then even though you asked me, I'll pass it to Mona because I'm sure she can add to it as well. We're working here in Arizona through the Braves grant. As I mentioned, we looked at just the location, and this was, so during COVID, the libraries stopped serving as cooling centers just because there were too many other issues that were going on in terms of capacity and safety issues, but some of the other facilities remained open. And so that map that I showed was looking at that. With the libraries, we get much better coverage, but still just looking at vulnerable populations and where they are. And it tends to be, although it's a very challenging population to capture, is those experiencing homelessness, you know, and where they are and trying to get the cooling centers to those places and kind of looking at that. But it's mostly a social vulnerability. Those that, you know, don't have the capacity to turn on the AC or fix the AC when it breaks, do they have access to cooling centers? But I will pass to Mona.
Actually, I'll add that your maps actually have been very helpful because, so GIS and the mapping of the cooling centers and the risk overall, right, social vulnerability overall has helped, for example, the city of Tucson figure out who's living in those zip codes. And in some of these zip codes that are highly vulnerable, it's predominantly, or there's communities that are mobile home communities in those zip codes. And so that has actually informed what they call heat canvassing campaigns every summer that the city of Tucson has started to do, which is to go door to door in those high risk neighborhoods and provide education, education on heat, access to light heat relief programs, resources on where the nearest cooling center is if they needed to go. So when we talk about, you know, impacting policy, you know, policy is a very broad term, right? Policy could be, yes, you know, some kind of emergency declaration made by a governor, but policy could be like an institution level or an organizational level policy or some kind of intervention that they're trying to make. So I do want to just kind of catch that. So your work has helped in a lot of those spaces as well.
Yeah, I have a question to Chris. So, Chris, can you check how do you identify the locations for your sensors installed?
That's a great question. So what we did was we tried to balance a couple of factors when we first reached out to the school. So things like income levels, pollution, background pollution levels, but also just geographic diversity. So what we want to do with the sensor data is to ultimately use the data to model air pollution in Tucson, even at locations without sensors. So to do that, we need variability in the data levels as well. So we tried to balance, I think it was 2-to-1 high pollution to low pollution, 2-to-1 urban to rural, but also 2-to-1 low income to high income.
One, here, 2, 3, yes. My question is for Dr. Lin. What are some challenges that you experience working with the sensors?
So when we first tried this project, we first installed printers on campus. About half of them got stolen or broken. So that was lesson number one. Don't put that where it's visible. And then working with community groups has been all really easy and really straightforward because they're the ones taking care of the sensors. So very great experiences, I'll say.
And then I have another question for you, Dr. Lim. You mentioned the increased burden on the EMS services during these intense heat periods, but does your work also explore like how we can be conscious of that and proactive in protecting our EMS personnel?
Right now, that's a great question to answer. So one project I'm currently trying to launch right now is to work with EMTs in Tucson to actually install the sensors within the ambulances to see what they're being exposed to when they work. So I think things like that could be helpful in answering those types of questions.
There was one more
there.
in the back.
I already forwarded.
You already, anybody, we can come back to the room. Anybody online have a question? No. Okay.
Yeah, I have a question to Heidi. Can you please share some of the challenges of working at the National Climate Assessment?
Oh, yeah, well, the biggest one is the mobility movement. Once the policies change, and all of a sudden, you can't work on climate change anymore, right? You know, that I think it would be challenging. So anything that we're, like this world, this talk, I was surprised you get the title. Right, is gonna be challenging to be able to stand up and deal with, and then as the administration changes. We've had that, and I'm sure Mona and maybe Chris has had the same problem, and many of you have had the same problem. The turnover in public health departments is just phenomenally painful. That whenever you're trying to make these changes that last longer than the individual in that position, is really, I think probably one of the biggest challenges, because the people I started working with, they've moved on to other stuff. And so that continuity makes it really, quite challenging to be able to deal with that. And then I love data, and I'm sure these guys can talk to data too, is that the resolution of the data is such a challenge. And I don't know if you guys noticed that both Chris and I have these Nemesis maps, and they're like the Western region. Like, how do you drill down into that and get data that's available across the national level that tells you something about what's going on in Tucson, or in my neighborhood of Tucson? And so being able to kind of walk across those different data platforms. I don't know, what do you guys think? That's like brutal. So I don't know if that answers your, but like you want to make these changes at a national level, but you're really working at the local level. And it's that back and forth iterative process that just is rewarding when you break through. But it's a challenge to get to that.
First, congratulations. I mean, this is really amazing work. And I'm struck by, to your point, like right now, your policy changes may be challenged by the thinking of the current administration, but, you know, hopefully that evolves. But I also think, you know, Chris, with your data particularly, and I think all three apply, as a clinician, if I knew that the data down near the copper mine was showing a significant change, like that would force me to be much more proactive in talking to my patients. And I wonder, how do we, because I know in clinical practice, we're armed with a prescription pad and we wait for the person to come in with a complaint. And we don't have a lot of extra time to be like going to conferences to learn these things. But how do we shift that paradigm so that we're getting real-time information to the practice? When you find these really meaningful data.
Like tag, very suspected one of us has some data that I completely agree to. I get to like, we build these dashboards, but can you do them into like your area, your clinic that's actually impacting you, because the data are so far away, and how do we get better at that? And then I think that, you know, we've done some work with continuing education. I love that Nemesis has that venue that we can tap into, because I think, that's not just about, and I think it's probably how we all approach teaching, is that that's not about you passing that test, but it's about yet another way to, you know, not what do you know, but what can I teach you through this test? And so I think that's another way that we can get that out there, that's kind of, trying to feed into that, but I think you're right, you have a finite amount of time to make that information. How do I give you the information that you need that can change your, I think that's a discussion that's ongoing.
I always involved in that. Yeah, no, like echo what Heidi said, but I think it, like, it's a downstream and upstream problem, right? So starting with the clinical students right now, I think is a great place to start. We're trying to do that with the climate and health like PE, making a plug, yes, it's cheap, but making a plug for that next semester, because that's where we're bringing multidisciplinary students together to talk about some of these issues. But I think the other kind of avenue that I haven't seen kind of tapped into is, you know, even within the clinical setting, there's, you know, nurse practitioners, there's so many other, we always hone in on the physicians, but there's such a big supportive environment, you know, and that I don't think we've tapped into or had those conversations with. We, for the heat meth work, we actually are kind of, one of our strategies this year was, let's go to the pharmacy, let's go talk to Walgreens, CVS, and see, can you post a flyer? Just to educate people. Guess what? The answer was no. No. We'll post CVS ads, go post a flyer if you make a plug for CVS labeled hydration packets. And we said no. So we went grassroots. We went to Genoa pharmacies, which serve rural communities across the state, and we partnered with them. So had I thought of that on my own? No. I think that's where having those collaborative spaces where people from different sectors, different disciplines can come together and really think about, you know, what's already in place. I think whatever solution, the higher chance to get solutions to be adopted, you need to have buy-in at the conception stage. Not after you've developed that solution and then you're like, here, I have the solution, can you implement it? Chances of it being adopted are low, so really having those conversations beforehand, I think is the key.
I agree with what Mona just said, so just from the example of the dashboard I showed, Sunset, which is school-based, and then Airspire, which is working with a community group in Patagonia. We're able to see how often it's being used, the websites. So the Patagonia one used very frequently. I think that's because it's working with a community group from the beginning, like Mona said. Also, they're very good at getting the word out, so that's been also really helpful. And whereas Sunset's more, I would say, geared towards schools and students and parents, so the difference has been pretty noticeable. So just getting local groups and community members involved at the beginning is a crucial step.
Right. I think we have this room, but if you would like to talk to the panel members one, you're welcome to stay. But otherwise, thank you for coming, and we'll see you next time.